on the HELP committee as well, and had basically the same discussion yesterday. Every time I get involved in one of these discussions, I want to make sure that the industry is aware, and that's from health insurance to pharma to hospitals, and even the people that make their living in the business, doctors and nurses. With the exception of the latter, where I think they're caught in the swirl, just like in big agriculture, where we increasingly have huge corporations that dominate, the landscape. At least in agriculture, there's transparency, and farmers know what they're buying and paying for. In healthcare, when I tackled this issue as a CEO of a company 10 years ago, and I look at this, efforts to further competition and increase affordability. There's no other industry that I'm aware of, especially one as large as healthcare, that needs the nudging that we're trying to give here on aging and in the HELP committee. I'd like to put all the CEOs on notice that now control the dynamic in healthcare, that have delivered the product that we're all grappling with, that we know has excellent features to it, where we do things really well in this country when it comes to healthcare, but it just costs too much. And hidden behind universally opaqueness, not embracing competition like all the rest of us do in running our businesses in other sectors of the economy. Thank goodness we're taking this on as a real issue. Until I don't know that we here will accomplish what needs to happen quickly enough to stave off, what may be solved through some type of crisis down the road, but I'm at least glad we're talking about it. Focusing in on PBM rebates, Senator Romney and I have got a bill that does something similar to what Alex Azar is putting out as a ruling, for Medicare and Medicaid. My analysis of PBM rebates is, why do you have a middleman involved? Number one, I don't know of one other supply chain in any other industry that has a middleman that's hired to determine how margin gets divvied up to get it through the supply chain. That's archaic. It's not needed. That should ideally be done by the people that make the product, big pharma, and the distributors and the dealers, the pharmacists. The only part of that network that looks to me like it's functioning would be at the pharmacy level, where in most domains you've still got lots of choices. It gets murky and confusing when you look at the distributors and especially the people that make it. I size up PBM rebates as around $150 billion a year, of which $85 billion of it, most of the rebate gets eaten up by the costs and the profits of a middleman that's unneeded. Whoever would like to respond to it, do we need PBMs? Do you think if we shed light and transparency on it, that this can get solved and drugs can get priced at a reasonable level without the need of an artificial middleman that exists in no other supply chain? Anybody that wants to tackle it?
I can start, sir.
Thank you.
So thank you, Senator, for that. The question about PBMs and their role, I think the answer from my perspective really is that we need to ensure that there is competition and a market. And that may or may not include PBMs. It doesn't necessarily have to. The ultimate question should be, the answer should really lie and be driven. We should get to the answer by looking to consumers and competition to lead us to the right path. And I think you've identified in your question very much some of the concerns we have about how the system that has grown up around prescription drugs and Part D, perhaps unintentionally in many ways, as creating its own kind of perverse incentives. It's not an example, we think, necessarily of the market driving to a conclusion and ordering itself in the way that your business is accustomed to before you got here. And so what we seek to do is to, within the confines of the government program, it is obviously a government program that we're administering here and the Congress has given us a task to run, how do we make sure that there is as much market competition so that that gets us to the right answer? And that's what we're looking for. And as to your legislation, I think, we're always interested in and willing to work with you and others on potential legislative approaches as well.
Thank you. I'm out of time. If there's another round of questions, I would have one, and especially addressing the consumer component, where I think it's been a atrophied healthcare user that's been, not participating in his or her own well-being as part of what drives most other markets as well. I'll save that for a second round if we have it. Thank you.